This is a comprehensive evaluation plan for the high-fat, high-risk, a roadmap to decreasing fat intake intervention program. High-fat, high-risk, a roadmap to decreasing fat intake is a nutritional intervention program developed to address the obesity epidemic among college students by decreasing dietary fat intake. A survey conducted in 2005 revealed that 3 out of 10 college students are either overweight or obese, and that overweight and obesity increased significantly among students in their later years. The program is designed for implementation at the 5 campuses of the Northern Virginia Community College with class sizes of 20 students. The program will be held once a week for 6 weeks. By increasing knowledge, self-efficacy, behavioral capabilities, and decreasing barriers, the program hopes to decrease dietary fat intake, which will in turn lead to a reduction in obesity rates among college students. Program evaluation provides feedback that are necessary for improvement regarding design, strategies, and implementation fidelity. It also provides stakeholders with information on program effectiveness, on whether desired outcomes were produced or not, in order to make an informed decision for continued funding supported by evidence-based research. The 3 stakeholders that will be interested in this evaluation are the nutrition educator, gatekeeper, who is the fitness center coordinator, and finally the participants. The comprehensive evaluation process is divided into 3 sections: the process evaluation, the impact evaluation, and the outcome evaluation. The process evaluation is used to measure how far the program was implemented as planned. The impact evaluation is used to assess changes seen in participants that resulted from the intervention program. Those changes will focus on the determinants that will produce short-term and medium-term impacts. The third and final evaluation, the outcome evaluation, is used to assess the health status of the target population and long-term outcomes produced by the behavioral changes. This table represents the 3 components that will be evaluated in the process evaluation along with the data collection methods. Using the appropriate data collection method for each of the targets ensures accurate results. Program activities will be evaluated based on relevance and objectives. The gatekeeper will complete observation and implementation assessment forms to ensure the program is using college resources efficiently. Participants will complete an evaluation form that addresses how they felt about the activities and their satisfaction level. This table depicts the 3 components that will be evaluated in the short-term evaluation. To assess short-term impact, outcome expectations and perceived threats will be used to measure participants' knowledge on content discussed in the program, such as the consequences of a high-fat diet. To measure participants' knowledge, a pre-test and post-test will be administered by the educator. A sample question would be asking participants to list 3 to 5 health-related risks associated with increased dietary fat intake. Other questions will consist of multiple choice and true and false questions, such as which of the following is a risk associated with a high-fat diet, with the options of obesity, laziness, cardiovascular disease, or both obesity and cardiovascular disease. Another question would be increasing fruit and vegetable intake helps decrease dietary fat intake, based on a true and false question. Behavioral capabilities and self-efficacy will also be used to measure participants' confidence levels in preparing low-fat meals. To measure this, participants will complete a Likert scale survey. A sample question would ask participants, how confident are you in preparing a low-fat meal? The participants will rate their responses based on a 3-number rating scale of 3, which equals very confident, 2 equals somewhat confident, and 1 not at all confident. On another section of the survey, participants will be asked to list examples of low-fat home-cooked meals, which will give the educated a better and more accurate assessment of whether home-cooked meals are prepared at home or not. This table depicts the components of the medium-term impact goals that will be evaluated along with the indicators of achievements and instruments used. The first behavioral change goal will be an increase in the frequency of low-fat home-cooked meals, which will be measured using a pre- and post-intervention survey that will ask them to list how many times they prepared a low-fat home-cooked meal and to also list an example of a meal that they have prepared. The second behavioral change goal will be to increase fruit and vegetable consumption, which will be measured using a food frequency questionnaire. This table depicts the components of the long-term outcome goals that will be evaluated along with indicators of achievements and instruments used. The first health outcome will be to decrease serum cholesterol levels, which will be measured using a pre- and post-intervention blood test, with post-intervention tests will be conducted annually to allow time for serum cholesterol levels to improve. The second health outcome is to decrease BMI, which will be measured using a pre- and post-intervention anthropometric measurements. Participatory evaluation will be the best approach for this evaluation. The target audience conduct evaluation through 3 different stages: the naming stage, the reflection stage, and the action stage, where specific questions are asked to solve a problem. Through these stages, the audience begin to draw questions regarding their current situation, such as what is the problem, which is in the naming stage, and from there they begin to reflect on why there is a problem or reasons behind it, with questions such as why is this the case, which is in the reflection stage. In the final phase, they begin to dig deeper into the problem and try to find ways to change by asking questions such as what options do we have? The use of this framework will allow the target population to be in charge of the problem-solving process to help them use the knowledge introduced in the nutrition intervention to reach a change. For this evaluation, randomization is not feasible and a control group is not assigned, so it relies heavily on self-reported responses in the form of pre- and post-intervention surveys. This type of measurement will require a change scores statistical methods analysis. Another type of statistical method that can be used is a paired t-test. This type is used to investigate the difference between two samples obtained in pairs, such as a pre-test and post-test data. This type of test would be helpful in analyzing data to determine whether changes in participant scores were produced as a result of the intervention program or not. To determine whether the intervention program will be useful for participants and stakeholders, results must be interpreted in terms of statistical significance and practical importance. To evaluate for statistical significance, a p-value of 0.05 or 0.01 will be used, and effect sizes must be taken into consideration. An effect size analysis of 0.8 is considered large, which means that the overall results are of practical importance. Failures in interpretation include participant retention failure, implementation failure, measurement failure, and behavioral adherence failure. Participant retention failure may occur for several reasons, such as time requirements, lack of convenience, lack of participant satisfaction, or transfer to another college. Students may feel a struggle with time management, which could lead to dropping out before the completion of the evaluation. Implementation failure may occur when program delivery was not executed as it was designed. Participation rates, class interruptions, or off-topic discussions affect delivery, which may prompt the educator to adjust the sessions accordingly. Based on this, if the evaluator assumes that the program was executed fully and correctly as it was designed, when in fact it was not, this leads to type 3 error. Measurement failure may occur when instruments used to measure the specific determinants or behavioral change goals do not align with the objectives of the program. Measurement error could lead to a decrease in the rigor of the evaluation. Behavioral adherence failure occurs when the health behavioral changes occur but do not produce a change in the health status. College students may have developed the confidence to be able to decrease their dietary fat intake by increasing fruit and vegetable intake or preparing home-cooked meals, but other factors such as continued consumption of sugar-sweetened beverages, large portion sizes, and the lack of exercise counteract the efforts of improving long-term goals of decreasing obesity or BMI measurements. Communicating report findings with stakeholders is an important step in not only to provide the results of the program evaluation, but to also allow the stakeholders to make decisions about their continued support of the intervention program in terms of providing the appropriate funding, staff, access to the organization or facilities, and available resources supported with evidence-based information. In order for the report to be of value, it must be presented in a format that is easily understood. It must be written to the specific stakeholder who will be making their decisions about the program, keeping in mind the reader's expertise, training, and educational levels. Report findings will be shared with stakeholders via emails for participants, in-person meetings with detailed reports of charts and graphs for gatekeepers, and an in-person meeting with feedback for the nutrition educator.